mitotic spindle inhibitors. So see, in this you have to know that both of them function differently. The this specifically Vinca alkaloids, they basically inhibit the polymerization via M phase, and these they inhibit the disassembly of microtubules. Okay, now in this there's this thing which is vincristine plus glucocorticoid can be used for the treatment of remission childhood leukemia. Then they are specifically used for pediatric solid tumors like Wilm tumor, neuroblastoma, rhabdomyosarcoma, and so on. Alright, then all this is fine. Now over here, now they can also cause hypersensitivity reaction, basically paclitaxel, not docetaxel. Alright, because why? Because there are protein bound, so that is why it is not. So then coming on to the topoisomerase inhibitors. Now this topotecan and this is camptothecin, and the other one is an epidophilin toxin. Alright, so basically this topotecan, it is basically going to introduce negative supercoils. So I'll just write it. So topotecan or irinotecan. Alright, now this topotecan, basically what it's going to do is introduce negative supercoils, which is going to reseal the DNA strand. Now this is used in advanced ovarian cancer. Alright, it basically causes dose limiting toxicity, which manifests in the form of neutropenia. Irinotecan, it basically causes diarrhea and myelosuppression. This irinotecan is also famous for causing something as cholinergic syndrome. Okay, now coming on to the etoposide. Now etoposide is basically used for, if I have space I'll write it there. Yeah, so etoposide, this is basically used for acute non-lymphocytic leukemia. High doses में it is hepatotoxic. Okay, then coming on to the antibiotics. Alright, so these both, okay, so these both are used in acute leukemia. Alright, so we'll just understand a few things about them. So this is something here there's something called as radiation recall reaction, which is very common. What happens is they generate semi-quinones, which is nothing but a free radical. Then this leads to congestive heart failure and cardiomyopathy. Now this can be decreased by alpha tocopherol, and the earliest morphological change is the endoplasmic reticulum swelling. Then there is loss of cardiomyocytes. That is what is called as radiation recall syndrome. Basically there is erythema and desquamation of the cells. Alright, so yes, so then coming on to bleomycin. Now bleomycin is responsible for causing pulmonary fibrosis. So what it does is there are type 1 pneumocytes and type 2 pneumocytes. So basically it causes the necrosis of type 1 pneumocytes and the hyperplasia of type 2 pneumocytes. Alright, and it also causes the flagellated pigmentation of skin. Alright, then yes, so then we'll talk about the miscellaneous drugs. So in this, first we'll talk about the tyrosine kinase inhibitors. So tyrosine kinase inhibitors, which is for example imitinib. Now this is used for CML. Okay, basically what it does is it causes the competitive inhibition of ATP binding of APL kinase in inactive conformation. Now in this CML also GIST. So this is gastrointestinal stromal tumors. Alright, then there's one more thing, that is sunitinib, which is used for GIST, and you have sorafenib, which is used for hepatocellular carcinoma. Both can be used for renal cell carcinoma. Okay, then there's this thing, a fact that you should know, which is the larotenib. Now this was the first drug specifically developed to treat cancer containing certain mutation. Alright, and there's one more one-liner, that all natural anti-cancer products cause bone marrow suppression except bleomycin and vincristine. Alright, then I told you that it can lead to the pulmonary fibrosis. Then there are just a few things like proteasome inhibitors and so on. So I think that much is not that important, but you can remember that there is something which is called as the mTOR antagonist, and they have something which is ending with limus, and these are used for breast cancer. Okay, then there are a lot of others which I don't think you need to know much about them. Then you can also use like prednisolone for leukemia and so on. Then in this androgen inhibitors, there is something which is called as flutamide. Now this is used for the treatment of the prostate cancer. Okay, then in anti-estrogen you have tamoxifen, which is nothing but a selective estrogen receptor modulator. So this is called as SERMS. So this is used in early and metastatic breast cancer. Alright, now this L-asparaginase is used in ALL. Okay, and basically it causes hypersensitivity reaction and pancreatitis. Okay, that's what you should know. And hydroxyurea is used in sickle cell anemia and PCP, thrombocytopenia, CML, then polycythemia vera. Okay, you should know this about it. Then we have this triretinol. Now this triretinol is something which can be used for the promyelocytic leukemia. Alright, then yes, then we're done with all this. Now I'll just give you some specific things that you should basically know about the drugs for like the drug of choice. So in this now you have to remember, like suppose like we have ALL, and then we have AML, then we have CML, and then you have CLL. Okay, so then you have HCl, which is hericellular. So first of all, ALL. Now in this now you have to remember that in induction phase that you can give vincristine, prednisolone and danirubicin. Alright, then for consolidation you give something which is called as hyper CVAD, which I'll tell you. So in this AML, this is the question that they ask. So you use cytarabine and you use a antibiotic which is danirubicin. Then in this question is asked imanitinib. Okay, now in CLL it depends upon the age, so either this or you can give chlorambucil. Okay, in hairy cell leukemia we give cladribine. Alright, then Hodgkin disease we give ABVT. So this is adriamycin. So bleomycin. Then you have vinblastine. Then you have dicarbazine. Now here, if you even forget, now you just remember adriamycin, you will remember. So B. Now sometimes you'll forget that it's vinblastine or vinblastine. Since B is pehle, so just remember vinblastine. Okay, and then you can also remember for hepatocellular carcinoma, as I told you, that is sorafenib. Now there is one more regimen which is commonly asked, that is the CHOP-R. Okay, in this you have to remember cyclophosphamide. Then HC, you have hydroxy downrubicin. Then also we have oncovin, which is nothing but vincristin. Then you have prednisolone, and then you have rituximab. Okay. Now in this rituximab, you have to remember that it is CD20 antagonist. All right. So this is used for the non-Hodgkin lymphoma. All right. Then for multiple myeloma, we have bortezomib. Alright. Then yes, then head and neck cancer, you have cisplatin and 5-fluorouracil. Alright. So this completes most of what we need to know about anti-cancer drugs. So we'll just go through one classification so that it is ingrained in our brain, and you can actually like make out like you remember stuff. So just give me a second. Yeah. So we'll basically use this. All right. Yeah, so see, I told you first we have the alkylating agents, right? So in alkylating agents, what you have is nitrogen mustards, then ethylamine, then alkyl sulfate, and trazine and tranethyl. So you remember all this, right? Cyclophosphamide, ifosfamide, chlorambucil, mephalin, carmustine, lomustine, bisulfan, and so on. Then in this you remember cisplatin, we have to give we have to maintain chlorine and all. In methotrexate, basically I told you about thymidylate synthase inhibition. Then 6-mercaptopurine, thioguanine, azothioprine, then 5-fluorouracil, capecitabine, and all. Yeah, so you remember that capecitabine causes hand-foot syndrome and so on, right? Then coming on to the next one, microtubule vinca alkaloids, basically they inhibit the polymerization through M phase, and this taxanes, they inhibit the basically the disassembly of the microtubules and so on, and they are responsible for bone marrow suppression, neutropenia, and so on. Then you have topoisomerase 2. Now don't get confused which is 1 and which is 2. Remember that one, remember that we call 1 as in Hindi we call it as ek, so ekan. Okay, so that is topoisomerase 1 inhibitor, and the other one is obviously topoisomerase 2. Then you have antibiotics, and then you have a number of miscellaneous drugs. So this completes the classification and all the important points that you need to know about anti-cancer drugs. So this was a long video, so if you found it helpful, do give it a like, share, subscribe, and you can also comment. Thanks for